Hello, I am Dr. Vikas oswal, chest physician from Mumbai. Special interest in tuberculosis. As we all know, India, a developing country. I would say rather developing, it is already developed country. The major problem what we are facing right now is of rising population. And because of this rise in population, there is simultaneously increase in disease and rise in infection. And that's because of this overcrowding, slums in India, as we all know, overcrowded trains, transportations like overcrowded buses, and market. Now, why I'm so concerned is all because of this rise in population and overcrowding. There is also uneducation. People are unaware of spread of diseases. As we all know, there are many diseases which do spread through aerosolic mode. That is, just by coughing, sneezing, yawning, they do spread diseases, especially respiratory diseases. Now, you would ask me, so what? Because the place where I practice, that is in Govandi, Shivajinagar, Mankhurd, Dharavi, you might have heard of Dharavi, the biggest slum of Asia. Right now, I would really buzz an alarm over there. Alarm? Yes. Alarm for rise in tuberculosis, cases of tuberculosis. I see around 70 to 80 TB patients per day. You will be shocked and surprised to know this. Out of this tuberculosis patient, most of them are young generation. That is right from the age group of 12 to 45. That is the reproductive age group, teenage and reproductive age group. So if the earning member of the family has been caught in this trap, just imagine what would be the status of the family members. Because they were dependent on this earning member, and now they have to sell out everything behind this earning member himself. So it's not only the patient, but it's all about the whole family who has been affected, and indirectly the economy of the country, which is really hampered and has been affected. It is better to change ourselves as early as possible rather than it's too late. Just 4-5 changes in your routine habits will really make a lot of difference to stop this spread of tuberculosis. Yes, tuberculosis. If you have a tuberculosis, that is pulmonary tuberculosis, that is tuberculosis in your lungs, it just spreads to each other only by cough. My one bout of cough releases around 3,500 bacilli. Yes, that's true. 3,500 bacilli in one single cough. If I am a TB patient, I shower 3,500 bacilli in one bout of cough. And a healthy member sitting right next to me inhales in the same environment. If he inhales the same air, and if one single bacilli also inhales in his system, and if his immunity is on the lower side, yes, he is going to be infected and diseased. And in a year, one single TB patient produces around 15 new cases. Now just imagine, if one single TB patient can produce 15 new TB cases in a year, the population of India is around 1.2 billion population. And that's the whole reason of rise in tuberculosis seen in India. Not only that, if I am a MDR or an XDR tuberculosis case, that is drug resistant TB, and if I give my tuberculosis bacilli to my colleague, my family, my friends, even they are going to get infected by the same strains. That is, they will also have primary drug-resistant tuberculosis. As we all know, the treatment of this primary drug-resistant tuberculosis is not at all easy. Consuming around 12 to 15 pills per day with shots, that is injections of around 6 months. That too uninterrupted treatment, which have a lot of side effects in mean course of while. It's a difficult task for these patients to take this medication. And in country like India, where there is a lot of private practice going on, patients are unable to spare out money or sell out money from their pockets. These drugs, they cost around 2.5 lakh rupees, and these patients who live in slums and who are low socioeconomic status patients not being counseled properly about the treatment duration, about the side effects of the drugs, about the uninterrupted treatment, they start purchasing these medications at the initial days of period where they're unaware that he's supposed to take this treatment for good 2 long years without any interruption. First month of the year, he manages to purchase the medication. Second month, he borrows money from someone else. Third month, it becomes difficult for him to purchase these drugs. Fifth month, he has to keep some land mortgage. Sixth month, maybe he sale off his house, his land of village. And seventh month, maybe he just stopped taking these drugs and medications. That's the sad story of each and every TB patients which is going on in India. Where patients do not go to public sector, where they have a provision of free medications, free investigations. Why? Because the queue in public sector is very long. Number of public sectors in India are less compared to availability of the private physician and a private hospital. These patients, they are scared to lose on their daily wages. They are scared that they will lose their daily wages, but they are unaware that this losing of daily wages is much more better than going to a private sector. Please lose your daily wages. Please go and take treatment from a public sector. There are availability of medications, free drugs. There are availability of free investigations from a government of India. Counseling, a very big part. Patients are supposed to counsel thoroughly regarding the drug to be taken, regarding the side effects which are going to be developed because of this medication, and the duration of the treatment. Otherwise, the youngest child which is having drug-resistant tuberculosis, you won't believe, is of around 2.5 months. The day is not far when each and every child over here will be having this primary drug-resistant tuberculosis, and it would be difficult to treat such patients. Yes, we all are sitting on a time bomb, and if this bomb is not been deactivated or decoded at the earliest, it is going to blast very soon. My humble request to each and every person treating tuberculosis in India, please counsel your patients properly. Please take care of the adherence part. Please help them taking free medications. Please help them have free investigations from public sectors and cure these patients before it's too late. One single habit of covering your face with both your hands. No. 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 It is supposed to be covered with both the hands so that you do not give your bacilli to your sisters, brothers, mother, father, or friend. And in return, they do not give it to other member of your family. This chain is supposed to be cut over here right now.